I study pediatric respiratory illnesses because I became so frustrated with the fact that there's so much uncertainty around diagnosis and treatment of this very common condition. So I think one case for me that really encapsulates this was a 9-month-old infant boy who came to the emergency department, had some fever, had some tachypnea, ultimately was diagnosed properly with bronchiolitis and sent home. 2 days later, that same infant comes back more tachypnic, more febrile, more tachycardic, but not toxic appearing. We admit the kid to the hospital. Within 4 hours, this child decompensates, needing bilateral chest tubes, cannulating for ECMO, and ultimately CPR was initiated, and this child ended up dying of hemorrhagic MRSA pneumonia. And for me, that tells us that we need better tools at the bedside to be able to risk stratify children in terms of predicting progression of disease, predicting clinical deterioration. And I think that within PECARN, a multi-center network of academic pediatric emergency departments, we have great power to be able to get these answers, to be able to seek these answers that's for questions that still exist for such a common illness. And I think that the investigators and the infrastructure that PECARN has allows us to do that in the most powerful way possible. These answers do exist. We just need to go search for them. And ultimately, I really believe that as a team, we can improve the health outcomes for these children with pediatric respiratory infections.